Hi everyone, and welcome back to my channel. I'm Dr. Aman Praveen, and I'm an intern in Sri Muthukumaran Medical College. And right now, I'm actually in General Surgery Department. It's my main posting, so it's around 6 weeks. And today is kind of the OT day of my unit. I'm in the first unit right now, and OT days are a little hectic. The most hectic are the duty days, where we have to work all 24 hours, and then the next 8 hours also. But OT days are the next most hectic days, because you see, in surgery we admit patients, we have daily dressings to do, we have some investigations to run for the patients. And when it's a OT day, you have to actually even shift the patients to the operation theater, finish the surgeries, bring them back down, and then there's the post-op assessment and all that. And then at the same time, we also have to see the patients who are in our wards also. So today we posted actually two cases. That is, the first case was a fibroadenoma of the left breast, and the next was a raise amputation of a diabetic patient. So usually the septic cases, that is for example wound debridement, amputations, and all are put in the last. And whatever like septic cases which we have, which is diabetic ulcers, maybe there's a amputated patient which needs dressing, and all that is supposed to be dealt in the end, because you don't wanna take those infections and introduce it to the normal aseptic cases. So that's why first in morning we came. I was a little late. நல்லா தூங்கிட்டு எந்திரிச்சிட்டு போனேன். அண்ட் தென் போனால் போஸ்ட் ஸ்டாப்பில் there was the patient. அதை பார்த்துட்டு அதுக்கப்புறம் வார்டுக்கு போயிட்டு அங்கே நோட்ஸ் போட வேண்டியது இருந்துச்சு. நோட்ஸை முடிச்சுட்டு பேஷண்ட்ஸ் எல்லாம் மார்னிங் பார்த்துட்டு வைட்டல்ஸ் எல்லாம் செக் பண்ணிட்டு அப்புறமா ஃபைப்ரோஅடினோமா கேஸ் வந்து மேலே ஷிஃப்ட் பண்ணி முடித்தாங்க. ஐ வாஸ் அப்சர்விங் டுடே. I didn't get to scrub in. And then the OT got over, and then there was this rush in the near OT operation theatre, where in the anesthesia department was full-fledged. They were preparing the operation theatre. So I went in and I saw my ma'am and sirs, because actually my first posting was anesthesia. It was anesthesia, and so yeah, I'm a little close with them. So I went and asked. They were like, there's an emergency case right now, they're doing a exploratory emergency laparotomy, which is it's kind of cool. It's not cool for the patient, but from learning perspective, it's really amazing. You get to see the skills of the surgeons, you get to see the skills of the anesthesia department, who are trying to keep the patient stable, trying to keep the patient alive while we do it. So actually the case was a 40 to 50-year-old male who consumed alcohol and in the morning, and the wife stabbed him near the left iliac fossa with a knife. So it's a medical legal case. The patient came to the casualty, and immediately they knew that you have to take the patient to the OT. And then it was the 5th unit's case. I'm in the first unit, the 5th unit's case, because it's their duty day. And 5th unit ma'ams came, the PGs came, the interns came, everybody were rushing, everything was working. And I kind of felt jealous, because they get to do this really challenging task for them, and that's amazing. But when I said this to my sir, and he was like, you see, these emergencies, right, it looks really cool, it looks amazing, because it's like you are the main character over there, right? But it's not a good thing or a happy thing for the patient. Getting stabbed, we have to think from the patient's perspective. And other thing is, it's a really really dangerous thing which we are doing. um, the patient was hemodynamically unstable, his pulse rate was through the roof and BP was falling. It's truly the skill of the anesthesia department, how they are able to keep the patient going even when he's actually bleeding inside his abdomen. That's skill. And the mams, when they put a midline and they were fast, they were working, they functioned like a well oiled, well lubed machine. And it felt amazing how talented they were, and I was jealous that actually I wanted to be that. I'm just not in that level yet, I guess. So they were, ma'am, she opened it up, she was exploring, she was checking all the solid organs, going through the loops of the bowel, and she found out the perforations. I mean, after the stab, there were like one through and through, one and one entry wound in the jejunum, I think. So one was done a primary closure and the other was done a resection anastomosis, a small one, but really it is really uh, really amazing. See, the situation which the patient is in is bad. The family members, they are also in a bad situation because nobody likes to get stabbed, and it's not a simple thing, right? But a blessing in disguise is this patient is an alcoholic, so he gets drunk a lot, and apparently since yesterday he hasn't been eating anything except he's been consuming alcohol. So technically it's kind of like nil peroral, and his bowel is like kind of filled with spirit, that is alcohol. So that was great. I remember seeing it. Ma'am was putting in the incision, and boom, flew so much blood, clots, fluids from the body, from the abdomen is coming out, and immediately they were putting suction, they were using pads, and everything was just to be honest, I was jealous. So that happened, and then we were observing, and then we came down, went to the septic OT, arranged the patients, and raise amputation was done to the patient. I came to my room early. I came at around 3 o'clock something, 3 o'clock or 2:30 something, and I rested because I was too tired. I was exhausted. I haven't had a proper rest for quite some days. And my room looked like shit, so I had to actually clean up the whole room. And so I had to clean up a lot of things, throw away a lot of things, set things in places, set my studying table so that I can study properly without thinking a lot. And வந்து தூங்கினேன், நல்லா தூங்கினேன். And then my bike has actually isn't starting, so I had to go to the mechanic shop with my friend who had to tow me. And அங்கே போயிட்டு டோ பண்ண வண்டியை விட்டுட்டு அங்கே பிரதர்கிட்ட வந்து ஃபிக்ஸ் பண்ணிடுங்கண்ணான்னு சொல்லிட்டு, and then I came back, and then again evenings I went and saw a few patients, and then I came back. I was kind of drowsy. I felt like sleeping, but I was watching a few lecture videos, and not a lot of passive learning only, not a lot of active learning like solving or reviewing MCQs, which I should do. I'm just too lazy to do it, and it's not good. And then night ஆனதோட செம பசி, ஒரு 11:30 இருக்கும்னு நினைக்கிறேன். சரியான பசி. ரூம்லேயும் எதுவும் சாப்பிட இல்லை. மெஸ்ஸுக்கு போனால் மெஸ்ஸில் இட்ஸ் ஒன்லி இட்லி. I don't like idli. ஸோ and then ரொம்ப பசிச்சுதுன்ட்டு வண்டி எடுத்துகிட்டு போயிட்டு ஒரு ஒரு கையேந்தி பவனில் போயிட்டு ரெண்டு பரோட்டா அண்ட் சம் பீஃப் சாப்பிட்டு அண்ட் தென் போயிட்டு ஒரு பேக்கரியிலேருந்து ஜூஸ் வாங்கிக்கிட்டேன். கேம் பேக் ஹோம், turned on the cameras and starting to record. So this is actually my day, and it's a little so the sound which you're hearing is actually some boys in the CRRI floor running around, probably a little drunk, I guess. We don't know, but yeah. So I'll see you in the next one. Yeah, cheers.